Hello, my name is Sean Sang-won Park. I'm a prosthetic urologist practicing in Seoul, South Korea. My practice is hyper-focused and specialized in penile implant surgery, especially inflatables. Recently, I was invited to the first Wilson Forum in the US. Wilson Forum is created by Dr. Stephen Wilson and his wife, Barbara Wilson. I call them Papa and Mama, literally and empathetically, because they are the one who socialized me and groomed me to be who I am now. They created this donation foundation for the better of the field of prosthetic urology, which is dealing the erectile dysfunction or incontinence with the prosthetics we use, like penile implant or the artificial urinary sphincter. Dr. Wilson has been training urologists about this penile implant surgery for the past 50 years. And he always stressed that we need to train next generation. We need to train other urologists so that they can perform or understand this penile implant surgery and can let the patients get treated with it. Most of the important problem we faced as a prosthetic urology is that public does not know and the doctors do not know about this surgery. So the only way to fight it and the only way to make more awareness, we need more people, we need more urologists who tackle this down in the coming days. With the goal of the better of the field of prosthetic urology, Papa and Mama created this foundation so that we can train next generations, or we can have prosthetic urologists learn deeper about this field. Basically, he wants his legacy keep continued for the next generations. So probably about 7 or 8 different countries and they came from, and we had 50 urologists. Every single one of them are high volume implanters, like so-called big implanters all around the world. We had a great discussion for about 8 hours. Even though nobody told doctors about this, even though nobody asked doctors about this, it is our obligation, it's a doctor's job to let the public know, let the other people know about updated medical informations, updated medical technologies, so that the people can get a proper medical services. For example, in the US, a penile implant is done about roughly 25,000 to 30,000 cases a year. However, breast implant is done roughly about 500 or 600,000 cases every year. The only reason why this happens, we believe, I think, is not many people know about this. Not many doctors even know about this. That's where the biggest challenge lies. So to fight against that, we need more comrades in this field, right? There was a topic I was assigned, and the other topic was also very interesting because they were invited to talk about what was the most difficult cases they had. We just become very transparent and become very sincere about what we were discussing, like a very difficult and sometimes hard to talk about. I was very happy with this because recent days, the conferences with the prosthetics, especially industry-sponsored conferences, they were aiming to train those who are not trained with prosthetics, new people in this field. So I was invited to that kind of conferences before, and yes, it is a great joy to be with those who are interested in my field. It's great happiness to sharing what I know. However, that kind of conferences do not let me discuss in depth with those who have a lot of experiences. You can do the deep dive with the newcomers. I always had that kind of thirst with me. And Papa and Mama, graciously, they created this conference so that we all could talk in depth and understand better the surgeon setting and learn a lot from each other. So in that kind of sense, I was very happy to be there. In line with the Dr. Wilson's Foundation's effort to train more prosthetic urologists, there will be 3 grant receivers from the Wilson Education coming to South Korea for a short fellowship in my practice. I want to show them, of course, how I do the surgery, but at the same time, I want to show them how I live as a prosthetic surgeon and a penile implant surgeon, and why I do that or why I like it and how I adapt it. Because that will tell them a different setting of what I do, or different point of view I can offer them. At the same time, their different point of view will affect me, will help me as well to understand better. Papa, Dr. Wilson always very stressed, Sean, you need to train others so that you can be a good surgeon. Now I understand that pretty thoroughly, because this kind of training will help trainees to learn, at the same time trainer, proctor to learn deeper. I think they are the first who did it, and I'm very happy for that. And I'm very happy that I am one of their board and was able to join this, because this is surreal. This is something I didn't thought that ever happened in my field. All in all, this kind of activities will definitely be a good impact on the field of prosthetic urology.